Lesson 27. Exercise guidelines for diabetes. In this lesson we will discuss benefits of exercise, screening the diabetic client, exercise guidelines for diabetes, and medication and their exercise implications. At the end of this lesson, you will be able to identify the benefits of exercise for the diabetic, describe screening procedures for the diabetic client, describe exercise guidelines, and outline the effects of common medications used by the diabetic and describe their exercise implication. Benefits of exercise. Both the American College of Sports Medicine and the American Diabetes Association acknowledge the importance of exercise in preventing and controlling type 2 diabetes. A combination of physical activity and modest weight loss has been shown to lower the risk of developing type 2 diabetes in higher risk individuals by up to 58%. In addition to reducing the risk of coronary heart disease and improving overall fitness, combined training of both CV and resistance may be of great benefit in controlling blood glucose levels. So some of the benefits of exercise then will include improved insulin sensitivity and blood glucose control. The body becomes more sensitive to insulin present in the body, and as a result then it can control blood glucose levels, so it can prevent them from getting too high or too low. Prevention or management of obesity. Improved physical fitness. Improved blood lipid profile. Because the diabetic tends to use fat as a source of energy, their blood lipid profile or their blood fat levels tend to be higher than what is normal. So exercise can help to keep these blood fat and blood lipids at a normal range. Reduced blood pressure. Reduced risk of thrombosis, which is blood clotting. Reduced risk of coronary heart disease. And psychosocial benefits, so for mental health and well-being. Screening the diabetic. People with diabetes are in a high-risk category, so therefore doctor's clearance is required. It's also important that they are made aware of risks associated with exercise and how it can affect blood glucose levels. So again, ensure that they sign the informed consent form. Check for cardiovascular complications like high blood pressure or heart rate abnormalities. Diabetes is a high risk for the development of coronary heart disease, so there is a high risk of cardiovascular complications being present. Seek advice on insulin and dietary changes if needed, and any such advice should be given by a qualified dietitian or nutritionist. Advise your client to check their blood glucose levels before, during and after exercise, and this is particularly important in the early stages of exercise. Have sugar or sweets at hand in case of a hypoglycemic reaction. And ensure the diabetic does not exercise alone or overtrain. And if it's not possible for them not to exercise alone, then they should wear diabetic ID. Exercise recommendations. The American College of Sports Medicine recommends initial instruction and periodic supervision then by a qualified instructor. Cardiovascular endurance. Frequency on at least 3 days per week, but with no more than 2 consecutive days. Intensity may need to begin at 40 to 60% of maximum heart rate, particularly if the individual has been sedentary, and then gradually progress up to 75% of maximum heart rate. Time. 150 minutes should be accumulated over the course of the week. And again, for the unfit individual, this can be accumulated in bouts of at least 10 minutes and then gradually increased until bouts of 30 to 60 minutes can be tolerated. Type: aerobic using large muscle groups. So again, walking, swimming, cycling. An increase in daily activity levels are also encouraged, so the use of a pedometer to achieve 10,000 steps a day may be helpful. Local muscular endurance. Frequency 2 to 3 times per week on non-consecutive days. Intensity 50 to 80% of 1 rep max. A higher level of intensity may be required in order to optimize insulin action. Time. However long it takes to initially perform 10 to 15 reps at one set, and then as fitness levels increase, progress to 8 to 10 reps, 3 sets at a higher intensity. Both machine weights and free weights are suitable. Flexibility can also be included, guidelines as per normal population. Effects of medication. The most common form of medication prescribed for the diabetic are oral hypoglycemics. There are 3 major groups: stimulants for insulin release, drugs to improve insulin sensitivity, and drugs that decrease absorption of carbohydrates. The latter 2 there, drugs to improve insulin sensitivity and drugs that decrease absorption of carbohydrates, have little influence on exercise. However, the stimulants for insulin release can be associated with hypoglycemia, particularly when in conjunction with exercise. So stimulants for insulin release are usually taken with meals, and their purpose is to stimulate the production of insulin, and they prevent excessive increases in blood glucose levels after eating. The danger of this is that when combined with exercise, that there is an increased potential for hypoglycemia. So the exercise implication for this then is that clients must monitor their own blood glucose levels frequently. Initial testing should be carried out pre-exercise, midpoint of exercise, and then post-exercise. So then less frequent monitoring will be necessary when drops in blood glucose levels during exercise have been established, provided those drops are within an acceptable range. And again, it's important to be aware that it is not the responsibility of the health and fitness instructor to check blood glucose levels. This is the responsibility of the client. Beta blockers are also a common medication that is prescribed for diabetics. This is because coronary heart disease is a major risk factor for diabetes. So beta blockers may be prescribed in order to control this condition. The difficulty with beta blockers is that they can mask the symptoms of hypoglycemia, and this can then cause glucose intolerance. So the exercise implications for this then are that again your client must monitor their blood glucose levels before, during and after exercise. And because beta blockers prevent the normal heart rate response to exercise, the use of the RPE scale is necessary in order to monitor intensity. Beta blockers are discussed in more detail in Lesson 7 in hypertension.